Hello, my name is Catherine Ward-Thompson. I'm Professor of Landscape Architecture at the University of Edinburgh and I direct Open Space Research Centre. And this presentation is my contribution to the symposium, and I'm about to share my slides, and I hope that this is of interest to all of you viewers. My talk is about health, green space and inclusive landscapes, the salutogenic city. And it focuses on aspects of access to green space and landscape design more generally that I've been working on with my research centre, Open Space, for many decades now, and particularly looking at the health benefits of engagement with green and natural environments. Now, one of the interesting things about links between health and environment is that the World Health Organization, for whom I've done some studies, writing work, I've contributed to some of their recent publications on urban green space and health. They see the UN, the United Nations Sustainable Development Goals, as a key way to develop and deliver public health. So although these are about sustainability, they're actually core to good health of human beings as well. And they see linking good health and well-being and sustainable cities as absolutely at the core of good public health, as well as addressing climate action and life on land. And just one of the goals that exemplifies this is Sustainable Cities and Communities Goal 11.7. By 2030, we will provide universal access to safe, inclusive and accessible green and public spaces, in particular for women and children, older persons and persons with disabilities. And this is something that the World Health Organization sees as a key element of providing better public health. And our approach to public health and our understanding of it is a socio-ecological one, recognizing that that outer circle of global ecosystem was something we used to think we couldn't influence. We now realize tragically that we can influence that, including climate stability. But the area where we have most immediate and direct effect, particularly if we're planners, urban designers, landscape architects, is those next three blue rainbow circles: natural environment, built environment, and what the environment supports in terms of physical activities. So this is our approach in open space, looking at that broad environment and recognizing that we, the people in the centre, and our well-being are influenced by individual factors, yes, age, sex, hereditary factors, but hugely also by these external environmental factors. And there is an increasing recognition that a new environmental conceptualization of health, ecological public health, is a necessary task for the 21st century. If we're going to address diseases, both communicable like COVID and non-communicable diseases which are rising across society, cardiovascular disease, for example, then we need to have health supportive environments. We can't just rely on medicines to deliver better public health. And investing in environmental interventions is seen to pay off for governments because it reduces the transfer of hidden costs from other sectors to the health centre. So an environment that supports good health means there is less demand for medical intervention and clinical intervention from the population as a whole. So it makes sense all round. One of the challenges, though, is that this is long-term planning and design, not an instant fix. We know that urban parks were considered an important part of health from the 19th century, the 18th century, earlier. They were first labelled the lungs of the city in London, in Parliament, in the 18th century. And that idea of public parks as supporting the health and well-being of its population spread widely in the 19th century with the urban parks movement across Europe, in Paris, in North America, in many parts of the world. Here is an image from Birkenhead Park in the northwest of England, outside Liverpool. But the quote here is from people talking in the wake of a cholera epidemic in London about the need for urban parks in London. Birkenhead Park outside Liverpool in Birkenhead was the first public park paid for by public money for public use in Britain and perhaps in Europe, developed in 1843. The argument for a public park in the East End of London was made after the cholera epidemic in the 1830s, where it was seen that a park in the East End of London would diminish the annual deaths by several thousand and add several years to the lives of the entire population. People said in Parliament, it will benefit artisans and labourers' health and that of their families by inhaling the fresh air at least once a week at a distance from their own confined and wretched habitations. These were workers who had crammed into the city from the surrounding countryside to get the work there as part of post-industrial revolution urban development, living in very cramped conditions, very polluted conditions, with little access to recreational space. And that idea of the public park as being health supporting was taken up by Frederick Law Olmsted in the United States and North America, who worked with an English architect, Calvert Vaux, to produce, among other parks, the famous Central Park in New York City. And he saw public parks not just benefiting physical health, but also mental health. The artificial conditions of the town, he said, produce a harmful effect, first on a man's entire mental and nervous system, and ultimately on his entire constitutional organisation. He saw the antidote as pleasing rural scenery. This quote actually reflects remarkably well what in the 21st century we understand to be the psychophysiological responses to being in certain kinds of natural environments and the benefits that that holds for our functioning both mentally, psychologically, but also physiologically. So one of the things that we have learnt through more recent research is just how important access to green and blue space it is for our health. Green-blue space is shorthand for green and natural environments that include shorelines, beaches, riversides, canal sides, but also the green environments that we have in many of our cities, public parks, as well as more natural green environments. And there's lots of evidence now that shows this is salutogenic, that means health supporting. And urban studies from many different parts of the world have shown that living near more green space rather than less green space means a reduced mortality rate. Now we know that your income level, tragically, is still one of the best predictors of your longevity and health. The better off you are, the more likely you are to live longer and be in better health. But even when we take this into account, we still see a green space effect, a benefit of green space for health, over and above any benefit of wealth or situation, socioeconomic situation. And the other thing, therefore, we find is that green space and access to it is equigenic. This has been coined as a way of saying it reduces those inequalities in health between rich and poor. So if you are poor but you have more green space near where you live, then you're more likely to be healthy, more likely to live a longer life than if you are poor but have less green space to access near where you live. So this helps reduce health inequalities, which are remarkably stubborn and resistant to clinical and public health interventions in general. And that's why there's a considerable interest in having better access to public green and blue space in our cities in future. Now, how do these work? What are the mechanisms? Well, there are probably a number of different mechanisms working together to produce better health. Physical activity, physical health is important, and we know that most of us are more active when we're outdoors than indoors. The most common activity that people do when they're outdoors in the open is walk. Physical activity is very good for our physical health, but it also has positive effects on our mood and stress, our mental health. Also, when we're outside, we're more likely to bump into neighbours, see other people, have some kind of social connection. In our ageing society, many people live on their own, particularly in very old age. There are many women living on their own, and we know that social isolation is an independent health risk. So being able to get out into a public park where we might see other people, even if we don't know them, a smile, an exchange of comment on the weather, seeing children play, that can all be very good for reducing social isolation and enhancing both our physical activity perhaps, but also our mood. Attention restoration is another theory that suggests how landscape and health are linked. Our attention when we work or when we're navigating a busy city street with cars and pedestrians and noises, or hunched over our computer doing our work every day, requires directed attention. And that becomes exhausted, particularly as we age. Different things that distract us can be very tiring on our attention that we need to focus on to do the task in hand. Once it's exhausted, there are certain kinds of environment that are better than others for restoring our attention, and the natural environment turns out to be one that is particularly good for that. One of the characteristics it has is what's been called soft fascination. It engages our attention effortlessly. So light coming through leaves, the sound of water, birds singing, the pattern of waves on the shore, those natural environments, often fractal, are very engaging for us. They take our attention, but it's effortless. And that effortless attention is considered to be one of the things that helps attention restoration. And after this, then we're better able to focus again on whatever tasks we need to do. More recently still, there have been a number of really interesting research findings coming partly from researchers in Korea and Japan, as well as across different parts of North America and Europe, linking landscape and health, independent physiological responses. We've engaged in work, as others have, on psychoneuroendocrine mechanisms that show we respond to natural environments physiologically in ways that are good for our health. Other research has shown immune functioning is enhanced, parasympathetic nerve activity, that's the relax and digest as opposed to rest and digest mode that we're in, that we need in contrast to the fight or flight mode when we have demands on us to pay attention, to worry about some potential threat. We also need to rest and digest, and that mode is supported by natural environments. And biological pathways are important because we know that chronic stress is not just bad for us psychologically, it's also bad for us physically. It leads to wear and tear on the body, what's called the allostatic load. And if green space can reduce stress, then it also influences physical as well as mental health. And we found through some of our research we could predict chronic stress patterns in a deprived urban population using salivary cortisol as a biomarker, by looking at the percentage of green space around where people lived. This was a green health study. We were looking at deprived urban populations in Scotland, so everyone was living in deprived circumstances. These were men and women aged 35 to 55 who were looking for work but not in work a few years ago now. So they were suffering from socioeconomic deprivation, struggling to survive on their income. And the people that lived with greater percentage of green space in the neighbourhood around their home had a healthier diurnal, that's daily cortisol pattern, than those who had less green space around their home. This was the first time, as far as we know, that objective measures of green space and objective measures of stress, using salivary cortisol as a biomarker, have been used and linked to show that green space near the home can support better health and physiological functioning. The same research project also showed via questionnaire surveys that if there was more green space in the neighbourhood, it was linked with the sense of place belonging, and both of these predicted lower stress. So perhaps having green space helps you feel that this place is more a place that you belong to, it feels like home, and this may also support better stress or lower stress. Similarly, access to a garden or allotment also predicted lower stress and was linked with place belonging and social connectedness. What are the other mechanisms? Well, green space encourages outdoor activities, as I've already said, but also it means you're outside. That means you have better chance of developing vitamin D, better circadian rhythms as we age. Sometimes we don't sleep so well. Being exposed to daylight and sunlight means that we have better sleep patterns at night. Vitamin D is also essential for us women, particularly for healthy bones, if we're pregnant, if we're breastfeeding, for young children, for older people. For all these reasons, it's really good to be outdoors and in some kind of non-threatening sunlight for at least part of the day, as often as possible. Reduced air pollution is another really important factor. We all know that vehicle pollution, among other sources of air pollution, is seriously damaging our citizens' health. And we know that green and gases and particulate matter can be filtered by vegetation, and living in greener areas is associated with lower exposure to air pollution, epidemiology shows. So that's another benefit of living in greener spaces in our cities. The urban heat island effect that many of us are aware of in our cities, which means cities are hotter than surrounding countryside, can produce lethal consequences, particularly for older people. Green space offers shade, it lowers the temperature in urban environments, particularly for low-income groups who may not be able to afford air conditioning. For older people, for children, it can be a really important part of creating an environment that is supportive for health. And interestingly, recent epidemiological studies have shown that there is an association between greenness or close access to city parks and healthy birth weight or level of development of babies born to mothers who live near more rather than less green space. So even in the womb, we're seeing beneficial effects of urban green space on health and development. I've worked for many years with older people on research looking at what supports their good health in older age. And if we know that access to green space is good for our health, we've been interested in what encourages us to get out more. We've worked with people across Britain aged 65 and older, and we know that if we have an environment that makes it easy and enjoyable to go outdoors, we're more likely to be physically active, healthier, and more satisfied with life. And these are the kind of results that I developed to show to politicians to give a sort of easy message for policymakers. Does closeness of green or blue space make a difference for older people? Yes, if you live within 10 minutes walk of a local open space. Our study showed that you were twice as likely to achieve recommended levels of healthy walking than if you lived further away from your nearest local open space. And our older participants were also more than twice as likely to be satisfied with life if they had a local open space within 10 minutes walk. How does design encourage or deter new users? This was a different study we did for Forestry Commission Scotland, looking at woodlands in and around towns and how good design and good signage can help support their use, but how bad design and maintenance and poor thinking about where to sign can actually make things worse. The two images on the left show entrances to woodlands that are not very inviting, particularly if you're, let us say, a woman on your own, perhaps a bit nervous about your personal safety. This is an unfamiliar place. You might not choose to go there on your own. And the image on the right shows two people trying to work out where on earth the entrance to this woodland is. It's a public woodland, but the only obvious entrance is that blue door that is very firmly locked and doesn't allow you in. And the map doesn't help. So these are studies we've undertaken where we've used behaviour observation to work out what's wrong with existing signage, notices, and access to green space. By contrast, these are some examples we came across which showed really good, well-designed access to, in this case, woodlands in and around towns, where the design itself is welcoming. Signage can help, but actually good design says, as all of these images do, you're welcome here. Come in. This is well maintained. The lovely ramp on the image on the right shows you that even if you're a wheelchair user or perhaps you have children in a pushchair, this is going to be accessible for you. You're welcome. Please come in. It feels welcoming. It feels safe. So good design can make a big difference to how people perceive and use public open space. A recent project that we've finished working with older people was called Mobility, Mood and Place, and explored how places can be designed collaboratively with older people to make mobility easy, enjoyable and meaningful. Mobility, Mood and Place involved co-created environments. We worked with our master's students in architecture and landscape architecture and older people in communities in a range of different areas: London, Hackney, near where the Olympic site was, Manchester, Edinburgh, and remote rural areas in the islands of Scotland, Shetland. And we absolutely need to include older people in the process of understanding what they want out of their environment for healthy and active older age. And these are 4 elements that we worked with older people to develop, that they told us were aspects of the urban environment that really matter. Access for all, inclusive access, access to nature, the natural environment, seeing the seasons change is very important. Access to others, that potential for sociability, and access to light. Good quality daylight is really important. And this example, this image, is just one of our students' designs showing a contemporary design for something that is actually a version of a peristyle, a covered space where you can be out of the way of the public walkway, but you can see people going by, you can see what the weather's like, you can choose to go out and engage with that public space or stay in a slightly more retreated mode, but sheltered, safe, but still watch the world go by. A nice example of how to address different demands. And this is just another example from that project, Mobility, Mood and Place. We published a booklet with Architecture and Design Scotland for Scottish Government that took some of the quotes from our older participants and some of our student designs that responded to them to show how access to nature could be provided, and also give links to historic parts of the city that resonated for people, that they remembered from their youth, that made a difference to them. We also did some quite innovative work using neuroscience. This mobile headset we used with older participants, including someone in their 90s. This tested their brain activity when they were in different urban environments, whether busy streets or more park-like green spaces. And we wanted to know whether we got a different pattern of brain activity in response to different environments. Busy streets, urban green, parks in the city, urban quiet, residential streets, perhaps with little gardens in front, or a busy street with traffic and shops. And we found, you can look at our publications to get the details of this, but essentially we found that the going from blue, urban busy, into green, urban green, a park, we found a drop in low beta. Low beta neurosignals are associated with needing directed attention, needing to pay attention, to be alert. And this, when we went into the green environment with our participants, reduced dramatically. We don't see a mirror image when you go from green to blue, from the green park to the busy urban environment. That response, that demand on attention seems to be buffered, so people are able to cope with that demand perhaps better because they've had attention restoration in the green environment first. And we think attention restoration theory, as I mentioned earlier, is the explanation perhaps behind this pattern that we've seen, where the soft fascination of nature and a natural environment engages us effortlessly and restores our capacity for directed attention. And finally, a third part of Mobility, Mood and Place, a very big project, looked at environmental histories, the influence of place over a lifetime. So we looked at where people had lived from the age of 11, so relatively early childhood, through to early adulthood, late adulthood. And these people, when we were studying them, were actually in their late 70s, early 80s. And they had lived in and around Edinburgh and the Lothian region around Edinburgh. And we looked at access to green space and public parks at different stages in their lives. We looked at 2 cohorts, people who were born in 1921 and people who were born in 1936. This is just one example of a complex geocoding using GIS that we used to look at where people lived at different stages in their lives in relation to where the public parks were. And we found a relationship between green space and mental health in older age across the life course. So we found that anxiety and depression, only if people were living in the most socially disadvantaged neighbourhoods, so this equigenic influence here, green space during childhood makes a difference to not only cognitive decline in older age, but also mental health. For anxiety, every decade of life lived near more green space from childhood onward makes a difference to lowering anxiety in older age over 70 years. So one of the interesting things, and again this is innovative, that we've shown is that we can see an effect of childhood access to green space in very old age. And that seems to be reinforced by access to green space in our adult lives, and particularly important for people in more socially disadvantaged circumstances, socioeconomically disadvantaged neighbourhoods. And some of our key findings, including an animation, is available. There's a link here, and you can find that through our Open Space website as well. So finally, to sum up, this is what, when I was doing work for World Health Organization European region, I was asked to summarise what do we need from green space in our cities. We need nearby greenery, easily visible from most places. So important for mood, stress relief, mental restoration, where we live and work, easy to get into. This may be private or semi-private or public, but it needs to be really near, within 5 to 10 minutes walk of where we live or work if we're going to use it on a regular basis. That means several times a week. We need small or private, semi-private areas at a local scale for children's play, for schools, for older people, for outdoor living, for gardening, really close by. Again, these need to be accessible, very easy to get to if people are going to use them and benefit from them on a daily basis. We need green infrastructure networks to make active transport enjoyable and attractive to get to all parts of the city. These need to feel safe. They need to take us away from motorised vehicle pollution. They need to be enjoyable and attractive. And we also need large parks and natural areas that are readily accessible for all, easy to get to by public transport for people who don't have private vehicles. We need sport pitches for active recreation, places for big family gatherings. We hope to all go back to those one day soon. We need places for environmental education and nature study, places that support biodiversity. So we need a full range. Where do we need these spaces? We need them close to where you live, where you work, where you play, where you learn. They need to be throughout the city, a really strong green infrastructure. So I shall finish there by mentioning 2 publications that I was involved with or contributed to for the World Health Organization. One was on urban green spaces and health, a review of evidence, for which I wrote one of the chapters. Very useful resource, and another on urban green space interventions and health, and some of our projects are mentioned in that. And you can see top left our Open Space website, where you can get access to much more of our research and publications. So thank you for that. I hope that in the panel we have a chance to answer any questions you may have on this, and I wish the symposium every success.